Signs of vitamin B12 deficiency and how to fix it. Vitamin B12, also called cobalamin, is a water-soluble vitamin. It is one of 8 vitamins that form vitamin B complex. Nowadays, vitamin B12 deficiency isn't a bizarre occurrence. Actually, it is far more common than most healthcare practitioners and the general public realize. According to a 2009 report published in the American Journal of Clinical Nutrition, vitamin B12 deficiency and depletion are common in wealthier countries, particularly among the elderly, and are most prevalent in poorer populations around the world. In fact, the report states that approximately 6% of people age 60 or older in the United Kingdom and the United States are vitamin B12 deficient. Why is vitamin B12 important? Vitamin B12 is vital for the formation of red blood cells that carry oxygen around the body. It is also needed for the proper functioning and health of nerve tissue, as it is involved in producing the protective myelin sheath that covers the nerves and conducts nerve impulses. It works together with folate in the metabolism of cells, especially affecting DNA synthesis and fatty acid and amino acid metabolism. This particular B vitamin also helps our bodies absorb folic acid, which facilitates the release of energy. Since your body doesn't make vitamin B12, it is important to get it from food sources, especially animal-based foods, or supplements on a regular basis. Always consult your doctor before starting any supplement regimen. How much vitamin B12 do I need? According to the National Institutes of Health, people in different age groups and expecting or new mothers need different amounts of vitamin B12 on a daily basis. What causes vitamin B12 deficiency? A deficiency of this important vitamin can occur due to a diet that contains very little vitamin B12. People who follow a vegan or vegetarian diet often lack this vitamin, because it is commonly found in animal products. Another common cause of vitamin B12 deficiency is pernicious anemia. It is an autoimmune disorder that occurs due to loss of stomach cells that make intrinsic factor, a protein which helps the body absorb vitamin B12 in the intestine. This leads to low vitamin B12 in the body. Who is at a higher risk? People age 50 or older. People who eat a vegetarian or vegan diet. Infants who are born to vegan mothers and exclusively breastfed. People suffering from diseases that affect digestion, such as celiac and Crohn's disease. People who have had gastrointestinal surgery. People who are malnutritioned. People who are chronic alcoholics. Here are the top 10 signs of vitamin B12 deficiency. 1. Fatigue and low energy. This vitamin plays a prominent role in energy metabolism, hence its deficiency has a direct impact on your energy and endurance levels. Vitamin B12 enhances your body's ability to make DNA for new cells to provide energy. It is also needed to form healthy red blood cells that carry oxygen to the whole body. Without proper oxygen levels, you feel tired and lethargic. Plus, B12 is needed to turn the food you eat into energy to power your metabolism. Low metabolism prevents you from feeling your best and performing at your highest energy level. 2. Numbness and tingling sensations. Vitamin B12 plays a key role in keeping your nervous system healthy. Thus, neurological signs like numbness or tingling sensation in the hands and feet can indicate its deficiency. Vitamin B12 helps in the manufacturing of nerves and, moreover, it has a key role in helping oxygen reach different parts of the body. Poor oxygen supply is one of the main causes of numbness and tingling sensations. Its deficiency can also cause balance problems. A 1991 study published in Medicine, Baltimore, highlights the effect of cobalamin deficiency in the nervous system, which causes loss of cutaneous sensation, muscle weakness, diminished or hyperactive reflexes, spasticity and urinary or fecal incontinence, to name a few. 3. Low blood pressure. Deficiencies of vitamin B12 and folic acid can cause anemia, which can lead to low blood pressure, also known as hypotension. Vitamin B12 helps your body produce red blood cells so that adequate oxygen reaches each and every part of your body, including the heart. A 2012 study published in the Texas Heart Institute Journal reports that vitamin B12 deficiency is well known among neurologists but is often overlooked by cardiologists when treating low blood pressure. If you suffer from low blood pressure, opt for a B12 test. Even moderate forms of low blood pressure can cause shortness of breath, dizziness, weakness, fainting, and risk of injury from falls. 4. Skin lesions. Low vitamin B12 can also cause skin lesions and hair changes. A 2008 study published in Canadian Family Physicians reports that vitamin B12 deficiency is linked to skin lesions. Unexplained and non-resolving skin lesions can signal vitamin B12 deficiency, hence you need to visit your doctor as soon as possible. Along with skin lesions, its deficiency can cause hyperpigmentation of the skin, which leads to uneven skin color and dark patches on the skin. 5. Depression. This particular B vitamin is also essential for mental health. Its role in forming red blood cells in turn helps support a healthy nervous system. Plus, it helps lower the level of homocysteine, a byproduct of protein metabolism. A high level of homocysteine in the body can lead to depression. This is why it is important to consider the possibility of B12 deficiency, especially among the elderly suffering from depression, according to a 2009 study published in the Journal of Clinical Psychiatry. Emphasis upon. In fact, a 2013 study published in the Open Neurology Journal shed light on the importance of vitamin B12 supplementation in the treatment of major depressive disorder. The study found that people with depression experienced significant improvement in symptoms when treated with vitamin B12 supplementation as well as antidepressants.